Dr. Smith?
Here.
Dr. McBride? Dr. McBride?
Yeah, I'm here.
Ms. Riaz? Dr. Garza? Dr. Hubner?
Here.
Bishop Hankerson?
I am on.
You have a quorum.
Okay. Good to hear you, Bishop Hankerson. First, I move for the approval of the September 23rd meeting minutes that I hope everyone has had the chance to review. Is there a second to the motion?
Second.
Thank you. Is there any discussion on the motion? Okay, hearing none. We have a roll call to everybody.
Dr. Smith?
Yes?
Dr. McBride?
Aye.
Dr. Garza? Dr. Garza?
Yes.
Oh, we did, oh, okay. Dr. Hubner?
Yes.
Bishop Hankerson?
Aye.
Okay, by unanimous vote, the minutes of the meeting are approved. All right, so one of the things, moving to the next agenda item, one of the things that the jail leadership has been talking to me about over the last few months is just the increasing frequency and intensity of mental health challenges that they're facing here at the facility with people coming in. And Director Anders approached me recently with kind of a concept that had been operationalized in some other cities such as Houston, and asked if I would come up to kind of an introductory meeting here at the jail to explain the concept of having a mental health diversion center where detainees who are coming in with pretty severe mental health disturbances could be housed in a way that is safer for them, safer for other detainees, and of course safer for staff. So do you want to kind of explain a little bit more, Scott, about what you're thinking and what the timetable would look like to do something like this? Maybe talk to us about possible funding and just take us through what you're thinking.
Yeah, so while we were at the MacArthur Safety and Justice Challenge Conference in Atlanta, there were presentations about mental health diversion centers and a lot of discussion, and several people here, Beth, Tricia, Aaron, other members of that team said that this is something that could be very helpful. So we coordinated a meeting on the 19th, just last week, and invited members from area hospitals as well as nonprofit agencies, prosecutor's office, police department, other stakeholders, and obtained information on one of the models that, as Jeff mentioned, is out of Houston. And this is being done in a variety of different cities, differently in each community based on the resources that are there and what works for that community. So in South Dakota, for example, it's more of a center that refers out then to other resources because a lot of people don't know how to access those. But in places like Houston, they actually have beds where people can stay and psychiatrists that can prescribe medication and get that person stabilized. So the goal is that that gives an option to the police. Instead of bringing them to the jail, they can be taken to a center like this, and then during the course of a few days, the prosecutor's office can determine, along with others, whether charges should be filed. And this allows access to places, even if it's a referral center, where that person might be able to be provided residential services until the trial date or hearing date rather than sitting in the jail. If you look at the population in the jail, the majority of people that are here for long stays are waiting for mental health evaluations. And so there was great support for this, and there are funding streams that can be tapped into. Also, MacArthur Foundation is very supportive of initiatives like this, and there are examples of private-public partnerships. So this is just a preliminary meeting to gauge interest, and we do have substantial interest. So
And do you want to talk a little bit about kind of the stakeholders who were in that room? Because it wouldn't just be something that the jail is, doing unilaterally. It would be something that would require a lot of partnerships from probably the prosecutor's office, the public defender's office. I mean, there would need to be broad buy-in to make this work.
Yeah, so we had the Department of Human Services, Department of Public Health, Department of Justice Services, all from the county, the St. Louis County Prosecuting Attorney's Office, Public Defender's Office for the state. We had representatives from the hospital systems here, as well as multiple nonprofit agencies.
So I would love to get just feedback or kind of preliminary thoughts from board members. I would also, and after we do that, I think I asked at the last board meeting if we had any data on the wait times for psychiatric care. And I think, as I recall, there were kind of two separate, pretty lengthy wait times. First, the time to get a psychiatric intake, and then secondly, there was still, I think, a pretty substantial wait time to get actual treatment after that. Have you been able to compile that, or is there a mechanism to compile that?
So right now we've been working with the county's IT department to establish a process that where we can gather information that Department of Public Health and Department of Justice Service have to help us track this. And at this point, on our dashboard, we have there is some information available on the dashboard, but it's clearly something that we need to track more closely and
to be able to make the case for funding for this. Right. I think having all that data at our disposal will be helpful. Yeah. Board members, do people, especially those with a lot more background in this space than me, have thoughts, advice?
I'll just speak up. Yeah, I mean, Trisha and I were really lucky to go visit the Houston centers a couple of years ago before the pandemic. And so to see it in action, and as Scott mentioned, MacArthur is supportive of this, and we have some money to either bring a group down to see one of these centers or to have people come. I think we have a lot of support that way. So I think the key is to build on some of the partnerships we have already built through the jail and everything else, but obviously it's going to take all of the partners. And hopefully, I would just like to put a public record, hopefully not just external funding from private funders, but also from the community as well. I think any investment from the county executive would be really helpful and would save the jail money in the long run. So I have a lot of support for it. I think there's a lot of different models. And so this is why I think we need to be patient and develop this over the next couple of years. But there were efforts to develop something like this before the pandemic, but we've had a shift in staffing in a number of roles since then. So I'm excited to see it come back up.
So Beth, you referenced kind of long-term savings, and it seems that one obvious kind of back-end saving would be that you probably have fewer incidents, in the jail if you've got a place where you're, have specialized treatment on the front end. Can you talk about other kind of potential sources of long-term savings that could help, all of us make the case for this, for public funding?
Well, sure. Well, I first want to say it's the right thing to do. People don't get
Yeah.
better in the jail. Like the jail does
Yeah.
a wonderful job, but this is where people deteriorate, understandably. So that's the main point. But yeah, I mean, we can, talk with Aaron. And there's also a lot of existing research. And we did this when we first started the MacArthur Project. A lot of people that come in for mental health challenges are frequent utilizers, we might call them, right? They come into the jail, they get some help, they come back out. So there's kind of two groups of people I think we could save money on. The people who come in time and time again, take up a lot of resources. And then like the Scott said, the people over 100 days. And that's really where a lot of our efforts have been, in terms of the MacArthur Project, have been focused on those people who are long stayers, but we kind of feel like we've hit the kind of limit in terms of reducing that, because those people just need that mental health. And, when we spend, I don't know how much we spend a day on jail, maybe $150, probably more. That's another way to save money. Yeah, so there's just a couple of different ways we could quantify it.
Beth, can I just add a couple things to that real quick? This is Aaron. I wanted to just back that up by saying that we, in our PRT group, our weekly group, we realized that for the first time in, I don't know how long, years, the percentage of low-level felonies who have been in the jail over 100 days has dropped under 30%. It's now in the 20s. So that's, I think, a testament to the PRT group, and backs up what Beth said about having successfully picked a lot of that low-hanging fruit when it comes to dealing with long, from a mathematical angle, dealing with long stayers, especially who are here for less serious charges. The other thing I wanted to mention, Jeff, is that to your point, the both your inquiry and other people's inquiry lately about dealing with or getting more information on mental health data. It's been a topic that's been brought up several times in the past few months, and it's definitely spurred some conversations with, and Liz is in the room, so she may be able to speak to more on this, because I can't pretend to be an expert here, but it's spurred some good starts of conversations with corrections medicine about how to identify people with mental health concerns from the jail's angle, because we don't actually have, like, it isn't as simple as just a checkbox or not a checkbox for who has a mental health issue. So one of the reasons why gathering this data, for example, length of stay for people with mental health issues, is a challenge, is because it's not always immediately obvious from a data perspective who those people are. So those discussions have started, but unfortunately, it's not just the kind of thing I could pull today and give you results in an hour.
Yeah.
So that's all I wanted to mention. You guys can go on.
Yeah, that's helpful, Aaron. Tim, I see you're have some thoughts.
Yeah, and I don't know how to raise my hand on this thing, so I'm just raising my hand. There's an electronic
We
hand
can see
thing. So, just in general, this sounds like a really good idea. And if there are models that are out there in other places, that's one thing to build on. So I'm glad to hear that. So going forward, I would suggest, continuing to look at what others have tried and then use that as the case. And it's great that the MacArthur grant might help support this. My question going forward would be sort of thinking through, kind of modeling this out. Like, in almost every meeting I go into these days, it's always about workforce. So I would like to, I'm not going to say don't do this, but I just want to know, like, how would this be staffed and how would it impact the other staff in the jail? Would you pull people, and it might actually end up helping. I don't know. I'm just sort of, learning. My ears are open on that one, because I would just wonder who staffs this and how does that affect everything else?
It definitely would help, Tim, because it wouldn't be Department of Justice staff that would be staffing it. It's a collaborative community effort in all these jurisdictions. So if you look at the transition center here in St. Louis, that gives you an idea of what the model looks like, where you have many community agencies coming in to a location that can provide assessment and services. And so it's almost like an extension of staff versus taking more staff to do it. And in this case, you have many different government agencies and private entities, as well nonprofits, and it's a win-win for everyone, because if you think about it, when people with deteriorating mental health issues end up needing to go for hospitalization, that takes time for justice services officers to stay with that person inside the facility. It creates security issues for the hospital, and ultimately the cost even for medication and medical care can increase. So the goal here would be, and we've had many, this is just one piece of a larger effort that we have to, you know, we've got Department of Mental Health involved as well, bringing a mobile unit to provide care for some of our most serious, people with most serious mental health needs. We have different departments like Department of Human Services that have a mission in this area, as well as Department of Public Health and Department of Justice Services. And even if you think about the county, we already have diversion and a mental health court, so the court system was involved in that meeting as well. So we're very excited about it. There have been SAMHSA grants that have come to the region in the past that provided some services like this, but nothing that would have been as coordinated as this will be.
SAMHSA, like substance abuse and mental health, yeah. Okay. I wish Nina were on, because Nina's organization, for which she works, would probably be a great candidate to be the type of nonprofit. She's at Places for People, which does a lot of this type of work. So I will brief her on this, and because I think she's somebody who definitely would want to be at the table and kind of bring insights from the stuff that Places for People does to this conversation. So am I okay to say in conversations potentially with policymakers in the county that this is an idea that the JSAB would be interested in pursuing and broadly supportive of?
So Jeff, let me just add a couple comments. So I'm not sure, I think the devil's going to be in the details. So if we're thinking about, establishing, so it sounds like you're wanting to divert people away from the jail to a whole different facility. Is that correct?
Well, it provides options. I think it's not that all would be, but there are a significant number of people that already have Medicaid or with Medicaid assistance could stay in other housing, even if it's with their family, but with proper care pending that trial. As you know, most detainees here are awaiting trial, and when there's over a year-long wait for mental health evaluations in many cases, and then people come back to the jail, and then there's a long wait for trials, they can even decompensate to a point that they have to go back for additional care at Department of Mental Health before they can actually even proceed with their final hearing. So the goal here is really just to make sure that we're working together as a community to address mental health issues, and if incarceration is not needed and that level of risk can be managed out in the community, then that's preferable.
Right. So potentially they're not housing people at all, but rather just getting them access to behavioral health services.
Yeah, and there are clearly some cases that the level of violence or the circumstances around the instant offense require that a person be incarcerated. So we're not saying that wouldn't happen, but we're saying in cases where there are options that we should make sure that we're addressing that.
Yeah. So sorry. So I'm in favor of it, but I think we have to also go into this with eyes wide open that the behavioral health and mental health services are stretched incredibly thin right now, and to layer more on top of that is going to be challenging. And so I'm just saying that from coming from a healthcare system, and I'm not sure who from SSM was at the table, but on any given day, we are challenged to take care of the people that just show up to our clinics and facilities with mental health issues. So I'm totally in favor of it, but I think we need to also understand the challenges that exist right now throughout the population. So not just in the jail population, and make sure we're not, overselling this. And then the second piece would be the sustainability piece. So, clearly this would need to have ongoing funding and support in order to make it work, which we all know that budgets are stretched incredibly thin as well. So just a couple of comments. I mean, I'm totally in favor of this, and I think it's the right thing to do. I'm a little bit cautious about how it all comes together, but I would be optimistic.
Your point is well taken, Alex. When my family had a kind of a mental health crisis a few years ago, as a upper middle class person with a lot of connections in this region, I was told it was going to take 5 months for her to see anyone, and with great health insurance, up and down the board. So, your point is well taken. That for anybody, it's really hard to find this kind of access, and obviously the population that we're talking about here is usually last in line for this type of thing, and so it's going to take, and money is not just a cure-all, because even with more money, there's just, I think, not enough psychiatrists to go around. Even the one in that personal situation that I referenced, even the one that was available in 5 months, could not, because of language barriers, the person in my family could not ultimately even understand that person. And so, let's make sure that we think through really hard, like whether this would require, a level of, let's not set something up that's going to fail and spend a lot of time and money on something if the, people would not be there to staff that under any circumstance, even if we did have funding.
Jeff, I want to add to the conversation. So you might be interested to know that there recently was a similar facility established for people with opioid abuse, and so there are many more people dying of opiate addiction and overdose than even firearm offenses. And so with mental health, we're not talking about additional people. These are the people with mental health issues. And if you go back to managed healthcare in the 80s, when many of these state hospitals were closed, now we're seeing the realization that that's making up 40% of the prison and jail population in the country. Nothing will change unless we initiate this, and so I do appreciate your support. And if you look at these different models, and we'll send this information out so you can take a look at it, there's nothing that says it has to be government-driven. There's nothing that says it has to be private-driven. There are examples of this being done differently in all communities. So it's possible that this could be just connected with someone who's already providing services and others come in to assist. But we as a community have to address this, and just what you've shared, Dr. Garza, is an example that there is a big need even among hospitals to address this. And so look forward to having everyone at the table and having more conversation about how we can address it as a community.
Okay, great.
Yeah, don't get me wrong. It's a sad indictment of the underfunding of this need. So I'm totally with you on that.
And I think it's probably even worse in rural areas than it is here, to be able to access psychiatric care. So, which is probably one of the reasons that hospitals in the metro area are overloaded, because we're getting people from rural Missouri and other places. So, okay, why don't we, just as kind of a next step on this from a board perspective, when you guys have your second meeting. I assume there's going to be some follow-up from the last meeting we had here at the jail.
Yeah.
Why don't I just send it to me whenever you give notice on that? I'll send it to the board. Do you mind if I solicit any board members who have some expertise in this space to come and join?
Yeah, this is definitely an area where we need everyone's help, and I will add that if it can be done in Houston, if it can be done in Miami, if it can be done in South Dakota, in rural areas, if it can be done in Reno, then it can be done in St. Louis. And so we'll share more information, and I think those details are extremely important, and there's a lot of different ways that this could be established. I always have said, even with resource acquisition and knowledge, most people don't know where to go and where can they go to get help. So you have 211 where people can call. There's long waiting lists. It's an excellent program to connect with resources. But even if this just the first step in incremental development of a process was that there was that it was built as a resource center where people could come in and find out where they could go, then this would be a win. One of the big parts of the discussion was that the number of people that need this is so large that it does need to be limited to people with accessing the criminal justice system, and otherwise it would be so our focus right now is people that are coming into the criminal justice system, but there's a huge need obviously around this for people that aren't even involved in the criminal justice system.
Okay, so not to put you on the spot, but are you okay if any of our board members would attend like the follow-up meeting?
I hope that you all will.
Okay. Okay. Anything else on that? Okay, appreciate everyone's feedback. All right. Next agenda item. As a reminder to the public, like 98 or 99% of the people in here have not been convicted of anything, and so they're eligible to vote. But there have been sparse attempts to facilitate that in the past, and you've kind of really taken this on. Can you talk to us about your efforts and where things are in preparation for the election in a week and a half?
So today, as we speak, residents are voting in person, absentee. The county voting commission has machines here, voting staff, and we have, in preparation for this, had people from Women League of Voters and other organizations providing information in person and on tablets, and they've assisted with residents interested in registering to vote. So that process is going on today as we speak, and we're excited about that and hope that continues.
Any questions about that?
No, just a comment. That's awesome.
Thank you.
It is awesome, and I hope it doesn't get in the media because I'm sure it will be distorted.
Well, so yes, in Missouri, while each state has different regulations, in Missouri, many people don't know that they can vote while they have a criminal history, and they're restricted from voting while they're under supervision. If they're under supervision on probation or parole, but when that term ends, then their right to vote is reinstated here in the state. So just sharing this type of information is important, but we want to take it one step further and let people experience what that process is like, because they'll be more likely to continue that if they learn what their obligation is as citizens to carry that forward when they're released.
Thank you for doing it. I really appreciate that. All right. Next agenda item is the racial equity study.
Okay, so I do want to mention too briefly, St. Louis University's college preparatory reading and writing classes are starting on Monday here, and they'll be held multiple days each week. And on January 17th, community college credit classes will begin, 4 simultaneous classes, 8-week classes.
What will the classes be in?
Series. They're introductory classes. Randy, do you have some details on what the classes are?
I don't offhand, I'm sorry.
Okay. They are centered around the initial core requirements. And so we'll get some more details for you about what those classes are.
I do, Scott, I'm sorry, I misunderstood what you were asking.
Okay.
Yeah, the first semester, which is 8-week courses, we're going to be offering history and English. They call it reading, but they're introductory college credit courses. That's going to be 8 weeks long. We're then going to, the second 8 weeks, offer that same offering to additional residents, and then at the same time enact 2 additional courses, core level courses. That's where you'll see the English and the math come in. The idea is to get core classes under their belt so that they can continue this education when they leave this facility.
Yeah.
So we also, in preparation for that, have members of the community college and another community organization coming in to help people fill out the FAFSA. Many of you who have had children know that that can be a challenging process. They'll be helping determine what other information may be needed, like the high school transcripts. So we'll be having assistance with getting them registered for college so that even if they're here for a short time, then they can continue on when they're released. We don't want them just to take these classes while they're here. We want this to be a bridge to furthering their education. And just the past 2 days here in St. Louis, St. Louis hosted a national conference on STEM educational opportunities for people with criminal histories. And so it's really a great opportunity for us to collaborate with educational providers throughout St. Louis region. And there are some online classes that may be even available in the near future, because down in Bonne Terre, the state prison, they actually have now accessed cloud-based educational material through a secured setting. And we've implemented wireless technology here in all of our classrooms for the first time.
That's great. That's great. Between the civic engagement component of voting, the SLU college prep classes, the community college classes, the job fair folks in here, and the job fair was on Tuesday. So, and you didn't have that on the agenda, but since I have some involvement with that, I can just give people an update, which is that I think like a dozen or so people who have their out dates, SLU came in and staff and interns made videos of a dozen of the departing detainees who got 2 minutes each to kind of say on a video, here's my story, here's my work history, here's how I screwed up, but here's kind of how I've overcome, adversity in my life and how I think my experience and my challenges have made me a stronger person and potentially a better employee, and these are my career goals. Those videos are packaged by this agency at SLU, which will packaged into customized video reels that about 50 different employers received on Tuesday. And then those employers got 2 days to kind of select who they want to interview. And so in the next probably 72 hours, between now and Monday, Tuesday, the dozen folks here in the jail, and then about 100 people more broadly in the community who have recently left prison, state prison or federal prison, are going to get paired so that they can have their job interviews with the companies that selected them. So that's great news that we've worked together to bring that opportunity to people leaving the jail. So hopefully they'll never come back here. Right. So lots of different things that were not happening here when this board was reconstituted a few years ago that all feed into rehabilitation, more broadly, that are positive things happening. Any questions about the job fair, the in-person voting, or any of the college prep and community college classes? Okay, thank you. Now, I was premature. Left out all that good stuff. Now the racial equity study.
So this week we held our first focus groups for the racial equity study that is being sponsored by MacArthur Foundation and Justice Systems Partners. And we had a focus group of, two focus groups of staff from multiple shifts, people with varying levels of experience, new employees, people that have been here for long periods of times in different variety of positions. And also our first focus group with residents from 2 different floors, and again, the cross-section of people that have been here for different lengths of time, for different types of offenses. And so that process has been initiated, and wanted to share with you, we weren't selected because of issues here or challenges. We were actually recommended for this based on progress that we've had through our MacArthur PRT initiatives. And so there's a lot of focus on the efforts here and the progress that we've made, and Aaron will be able to share information with you, but this is another way that we can help address equity and making sure that people have access to some of the programs that have been mentioned here, and equal opportunities in terms of posting bond and even with the judicial process.
Tim, is that your hand up, or is that something on your head that itches?
The latter.
Okay.
No, it's in the notes. No, I'm fine. That sounds really good. I'm fine.
Okay. Any other feedback from the board on that? Okay. Thank you for that update. So, you know, we spent a long time trying to get the CGL review. I was largely pleased with it, but not completely. As part of that review, you and I think Randy put together a spreadsheet of all the various recommendations. We appreciate the internal efforts towards accountability and, you know, for the implementation of the recommendations. We want to assist with that. And so today we will formally appoint 3 board subcommittees to evaluate what you've already done, which is substantial, to begin implementing the recommendations, and then help guide the full implementation, hopefully over the next few months. So those 3 committees are programming and reentry preparation. Bishop Hankerson and I are going to be leading up that subcommittee. The second is broadly like a health, subcommittee, and Nina, Tim, and Alex will lead up that subcommittee, and then staffing, which Bishop Hankerson and I will lead that up. And Beth, you're welcome to join any that you would like to join. So just let me know either now or after the meeting if you'd like to do that. So,
and I would just wanted to
sure.
jump in too really quick. And of course, I'll help with anything, particularly with reentry. And I think we should kind of perhaps merge some of the work that's already been done on the MacArthur Foundation, because we do have some subcommittees already and as part of that. So that's kind of where I've been working. So I'm happy to kind of merge some of that work together so we don't overlap, I guess, is what my only suggestion was.
That's a great suggestion. So merged into the programming and reentry prep subcommittee. Okay.
Yeah.
That sounds good. Why don't you and I just coordinate offline to figure out like what are the logistics of how we do that? Okay.
Perfect.
Okay. Super. So what I would ask is that between now and the next meeting, each of the subcommittees do like a Zoom or an in-person meeting with at least you 2 and anyone else that you think is relevant, just to do the initial, like, here's what we've already done, and to look at the spreadsheet, which if I haven't sent this, I think I sent the spreadsheet to board members of kind of, you know, the list of recommendations, but I'll make sure that I resend that out to prepare everybody for those meetings. So I will work with Penny to schedule those subcommittee meetings, which, you know, probably is, you know, I think Zoom is fine for that. All right. Thanks everybody for your help in
Can I make
advance.
a quick comment, Jeff? Sorry.
Of course, Tim.
That seems like a good process, and thanks for setting it up. And, you know, the CGI, if I get the initials right, was a comprehensive report with a lot of pages and a lot of recommendations. So I'm a spreadsheet kind of guy, so I like that spreadsheet. And so I'm guessing that, you know, I think Director Anders showed that to us early, but I'm assuming that it's probably going to be updated as we go, as more and more things happen. So if there's a, you know, I'll be using that to kind of track how we're doing in response to the report. And so not just in our little subcommittee, but the other ones, you know, if we could just keep that spreadsheet going and shared with us, or if there's a place we can get it in a behind us paywall or something, that would probably be good.
Like a Google Doc that we
Yeah.
all have access to. Is it
Yeah,
in that format?
It's a shared,
It's a
shared file.
Okay.
Yeah, I would just kind of recommend that, and then we can kind of track what's going on, because there were a lot of recommendations in there, and I can't keep them all in my head. So we can just kind of tick it through and go, hey, look, you've gotten 13 of the 15, one of the last two, you know. So I think that would be great.
Do you know if we're all enabled to view it?
If you take that link and reply to me, then I can authorize you.
Okay. Okay, so I will make sure that we all have the ability to access it, and that will form the basis of these conversations in the coming weeks. Thanks, and then Beth, me and you will figure out the logistics on the program side. Frankly, I think that that's the place where we had done where I think, you know, Scott had done the most kind of advanced thinking about what needs to be done, you know, before CGL's report came out, because it's obviously a passion of yours. But there's a lot to talk about in that space, because they're doing so many different things, and it may be helpful for us to figure out, and, you know, to take a look back at like the last, you've been here for a year and a month or something?
Yeah, as interim director was October 1st.
Okay, so yeah, like, but I think it's going to be helpful for us to look back and be like, okay, we did those 9 things. What generated the most interest, and what generated like the best results among detainees? Because it's going to be impossible to sustain 15 different things, but it will be possible to sustain like 4 or 5 different things, right? Okay, so speaking of the CGL recommendations, that's the next item on the agenda. And I'd like to get an update from you on where things are, with special attention to staffing, which was, I know, a big thing that was a crisis for us a year ago, got better in the wake of the pay increase, had some challenges over the last month or two, and I'm wondering if you can speak, you know, to some of what we're seeing now in the context of a broader update. Does that work?
Yeah, sure. Yeah, so we have hired 70 officers. We began with 84 vacant officer positions, and but as we have added officer positions, we had to create supervisory positions to supervise officers, which creates additional officer vacancies. And we have had a few people that have left for other positions, some people that are no longer here based on performance or other issues. And so we are, right now we have about 39 vacancies, and we are continuing to have bi-weekly hiring events, just last week we attended 2 career fairs at other locations. And so we're continuing to bring in new classes consistently. I think those vacancies will be filled by the end of the calendar year, and there was a budget request for the 16 additional positions that were recommended by CGL based on the 5-year implementation plan, and they're finding that we were 77 officers understaffed. So our goal is to hopefully get the approval from the county council for those additional positions. And then in concert with that, if you looked on the spreadsheets, the first items relate to restructuring of the unit management positions. So there would be a reduction in majors from 5 to 3, and then placing people in lower level positions that oversee those floors. And we also have an item here to have 10 additional officers added to the transportation unit. I'm really proud to say, though, that we've been getting all of the residents out about 10 hours per day, which is even more than they were before the pandemic. So we're at a point where we are able to roll out all of these programs that we've discussed. And so we're making real progress there. We do need your assistance in recruiting, and that's an ongoing effort. But our recruiting team is doing some very innovative things, and we're seeing the results of that now.
Can you talk a little bit about what you're, if you're seeing any trends, like changes in like what people are saying when they leave? Because presumably when the salary was a little bit lower, maybe it was more like we're leaving for more money somewhere else, and maybe now it's less like that?
Yeah, so we're actually, a good point that you made. In the past, when I started, there was discussion about salary for sure, but there was also discussion about the pandemic and a lot of people preferring to work remotely, children's schools being closed, daycare being hard to find, and also a way that they were being treated by supervisors in the communication or challenges there. And so we've made a lot of progress. The child care in schools are open again now. There are still some people that prefer to work remotely, but we have tapped into a number of different places. Like we've been to community colleges. We've had them come and have their students tour from associate degree programs. We have communicated with veterans agencies about the incentives that are here. We've established Department of Labor apprenticeship for new officers that gives 30 hours of college credit when they complete that, as well as a grant that provides a $500 hiring incentive. So we're doing a lot on the front end of that. Now, we have actually had people come back to the jail that left for some of those reasons, and there are many that have come back to work here. So we've had merit increases for the past 2 years, while there was a gap where those hadn't been provided for many years. And so we're working more on finding additional incentives that can help meet the needs that people have that are geared around their income. But we're still addressing the need for supervisor training. We have a lot of new supervisors, a lot of new staff, so we're expanding our training opportunities. And yeah, I think that's an area that we need to continue to work on.
All right. So CGL has some other recommendations that I think you want to update us on.
Yeah, so we have, in addition to those first that relate to the unit manager position, we're still working on identifying current policies and procedures that are not regularly followed or inconsistently applied, and improving that consistency is assigning a diverse team to work on recommended revision of selected policies. We're monitoring the shift.
Give us an example of a policy that was not consistently.
Well, we we actually have implemented many policy changes here. So this particular item actually calls for getting additional input from staff and management and supervisors in terms of additional policy changes that they think should be made. And when you have over 300 staff, you can imagine that not everyone agrees on what those should be. So we want to have the feedback from them, and then we'll be able to look at additional policy changes. But some of the policies that have been changed, some examples are during the first 6 months, officers were not allowed to use paid time off. And you can imagine challenges that would create. Paid time off is equivalent of leave or sick leave. So if you have COVID or you have children that aren't able to attend school, that was counted as unauthorized time off. And there was a policy that would extend their probation 6 months if they had more than 20 days of unauthorized time off. So those are two policies that we changed because we need to have more flexibility during a pandemic. There was a policy that limited access to internet for some staff, and we realized early on when they were required to register for COVID vaccination that they needed to have access. We'll have to listen. So we'll check on that. There's an alarm going off right now, just so you know. So we're going to continue to look at that. Another policy that's being examined and is on the spreadsheet is whether or not, what the personal standards are for appearance. So are body piercings allowed, for example? And length of hair, some things, length of fingernails, length of eyelashes, some things that may impact people's safety. So the General Counsel's Office have reviewed that, and we're working on updating and revising that policy. One thing that I can tell you, an example of this is when everyone's wearing a mask, you don't really know if someone has a nose earring or not because they have a mask on, right? So we have to look at things like that. So we have a number of other areas. We are continuing to monitor the shift relief factor, and that's already improving. Shift relief factor means on how many extra people would you have to staff because people don't show up for the scheduled shift that they have. And so with the rule change for overtime made by the county during the past month, we are now saving 500 hours of overtime each pay period, and people are showing up for this shift that they're scheduled for now because they must work 40 hours before earning overtime. So already we're seeing an improvement in the shift relief factor, which will impact that overall number of officers that are needed and provide us with some savings. Recommendation was also to assign some rover positions on floors, which we are working on, and acquiring technology-based solution for scheduling, establishing clear distinction and rules between planned and unplanned uses of force, including mental health and the use of force authorization protocols, clarifying in policy that not all options identified on the continuum of force are required in order listed, depending on the situation that dictates a higher level of response, designate an external body with responsibility to review random samples of force reports and all reports that have resulted in injury or that are deemed questionable by any party, establishing guidelines and policy to define a path for authorization for administrative segregation placement from either the classification manager, unit manager, or designee, establishing a formalized process outlining the requirements for step-down and less restricted housing for supermax security, requiring appeals of disciplinary sanctions be reviewed by a consistent and trained administrative person outside of the affected unit. And then there are about 20 recommendations for healthcare that DPH will be working on, and that will, some of those will require us to work together. So that, those are the remaining items that we have on our spreadsheet.
Okay, well, we all look forward to drilling down into some of this stuff as part of our subcommittees, and appreciate the, public airing of all this stuff. And now we'll, kind of do our work in smaller groups to make sure that the rest of the recommendations as appropriate, are implemented. Thank you.
Thank you.
All right, Aaron, you ready for the dashboard?
I am.
All right, let's do it.
Share. Oh, I'm trying to move to the other tab. There we go. All right. So, several things I wanted to mention this month. First, I wanted to hone in on the daily population because this is great news. As of this morning, our daily population was at 769. This is by far the lowest that we have been since the beginning of COVID. So this is, if you look at the overall trend since about beginning of February of this year, we are down over about 125 or so people over the course of about 8 or 9 months. And as you can see, since the beginning of February, it's just been going down, 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 and we continue to be going down. So 769 as of this morning is a pretty good achievement and I think it speaks to all the efforts that we've, had over the past year or so. So that's one really good piece of news. Another piece of news is that length of stay was down in September. I don't have the overall numbers for October yet, but length of stay was down in September as compared to August by about 18 days. Average length of stay in August was 88 days. In September was 70 days. So that's also a positive development. I also wanted to actually focus on one of the bottom windows. We don't go over this very often, but I wanted to show you this window here. Basically what this shows is like on average over the course of each month, how many people are in particular statuses in the jail. So the orange is sentenced, the green is probation violators, the purple is federal or contract, then other and pretrial. And what I want to show here is that if you look at the combined height of the bars that are not the pretrial bars, so all the orange, green, purple, and black, we're basically at an all-time low there, which basically means that we are, the proportion of people in the jail that are pretrial is at an all-time high or close to an all-time high. And that just speaks to what Beth had mentioned about doing a really good job of, well, basically getting all the people out that we can. If you look at like January 2020, before the pandemic, we had a huge proportion of people who were not pretrial in the jail. And now our proportion of people who are not pretrial is much, much smaller. So that's, I think that just goes to the successful low-hanging fruit angle that we were talking about a few minutes ago. Anybody have questions on the main dashboard?
Can you just give us a minute to look at the map up close?
Sure. I'll zoom in on St. Louis County.
Yeah. I mean, so how is this integrated into our racial equity study? Because obviously the darker the shading on this is,
right.
That's where we have more people, and that pretty much tracks with the Black population.
Right, absolutely. Beth, do you want to speak to that a little bit?
Hey, Beth had to check out at 10 o'clock today.
Oh, did she? Well, Beth is kind of spearheading the racial equity project. So I don't really know the specifics of, if I'm to be honest, I don't really know the specifics of a lot of how that's going and how that's going to work as it relates to targeting, improvements in heavily minority communities. So I would want Beth to speak on that because she'll be a better voice for it than me.
Okay. Are these zip codes?
Yes,
The lines here, are they zip codes?
they are zip codes. And just so you know, the gradation is that I think there are 6 different levels, and the darkest green is more than 300 admissions to the jail since the beginning of 2020. Although that doesn't necessarily tell the whole story, because even within the dark green areas, there are big differences. So for example, this zip code has 63138 has 409 admissions since 2020, but this zip code 63136 has over 1,000 admissions to the jail since 2020, and I think that's more than double any of the other zip codes. If you break it down by zip code, we have an enormous, overwhelming number of people who come from 63136.
Is that Jennings?
Yeah. Castle Point, Jennings. Yeah.
So,
Okay.
can I pop in
Go ahead.
real quick, Jeff?
Of course.
So, just on this particular thing that we're looking at, I think I would love to have Beth come into another meeting and talk more about your question, and how that analysis would be done. I would think we might want to not just use the map, but also correlate it to some important characteristics of the people in those zip codes. That's probably where we're headed.
Yeah.
And, that's one of several things we could be looking at. I'd love to hear how we're going to sort of disentangle social determinants from everything else. One question I might have real quick before you leave this, Aaron, is the zip code, is that the zip code address of the person or where the crime occurred?
No, it's the address of the person. We don't have any information on that, on the crime occurrence. Yeah. So it's just, and the zip code data is, it's hit or miss. So there's some entries that are kind of like, just sort of like garbage data that get discarded. But I think for the most part, like, I think I did a study, just a one-time check on this a while back, and I think it was like about 90% of the zip code data looked like it was pretty good. So, maybe the numbers on here are maybe a 10% lower than the actuality, but I think, in proportion to what the reality is, I think the data on here is actually pretty accurate, as long as you consider that there's some missing numbers.
Can I ask a question about the number of people in the jail real quick?
Sure.
Go back on that.
And I do want to go back to the map in a minute, just to mention one other thing. But
you can do it now if you want.
No, please, Tim, go ahead.
So just a quick question about this, and it's probably, usually I have my own version of the map open so I can hover over things, but I don't, maybe just because I'm still discombobulated. But the drop in the number of people in the jail is obviously it's probably got something to do with the court, so that's part of what your other analysis showed. But how many of the people who are, if we look over time at this, how many of the people were for lesser offenses than felonies? Do we have that in a chart somewhere?
Well, actually, I can pull up a spreadsheet that shows that. So hang on one second.
Or you can send it to me if you want. If you don't want.
I can send that to you. Yeah.
Labor the meeting, but
here, this might get to what you're looking for. So this bottom right corner, this is the breakdown of basically an average day in the jail per month, and it's broken down by offense types. Tim, I don't know if this is what you're looking at, but
I remember that we had this. So this, again, that's great.
Yeah. September, we had about 266 on average people here for A felonies, 154 for B felonies. So as you can see, this is something we've talked about before. The majority of the people who are sitting in the jail at any one given time are here for A and B felonies, and that's because those tend to be the people who linger the longest. But it's actually very different for the total number of bookings, because there's actually a lot more bookings for lower level offenses. Those just tend to constitute the in and out daily churn of people who stay very short times.
Yeah, I figured that was the case. I just wanted it said out loud for the public because
Yep.
I'm sure it's always understood that
Yeah.
that's what's going on.
No,
Thank
that's a good question. It's the composition of the jail at any one given time versus the composition of all the bookings into the jail over a certain period of time tend to be very different distributions. And that has to do with the length of stay that the long people stay in versus the less serious charges.
And that's what logic would suggest you should do.
Yep.
Yep. Thanks.
Sure. The one other thing I wanted to mention about the map was that we do talk a lot about racial equity, and racial equity is obviously very important. As it's probably evident, most of the zip codes up here are the admissions into the jail are overwhelmingly Black males and Black females. If you click on any of these, you can see that. But I do want to mention there is also a smaller pocket of the sort of inner South County here with a fair amount of admissions to the jail, and these zip codes tend to probably unsurprisingly, because South County is highly white, have a fair amount of admissions to the jail for white males and white females as well. So there's in particular a lot of drug offenses that come from these zip codes. Not nearly as many firearm offenses, but a lot of drug offenses. So I think it's also just important to remember that there are other pockets within the city and the county as well where that also have high concentrations of admissions to the jail. North County is the biggest, but there are others too. Does anybody else have any questions on the main dashboard?
I could look at that map all day.
Yeah.
Okay, I don't have any more questions about the main dashboard except to observe that now that we're in a better place than we were a year and a half ago on staffing, and a much better place than we were a year and a half ago on numbers when we were, above 1,000. And we know that we're going to be having budget needs to fill the additional positions and then potentially to contribute to a mental health diversion center. I wonder if we shouldn't just, sort of contemplate the possibility of that federal contract that we pushed away, that we exited, a year and a half or so ago because we didn't have capacity, because I know that was a substantial revenue producer for the county. I'm not trying to reverse the gains that have been made, but I'm just wondering if that's something that's on the radar screen or something that's been pondered at all.
So at the budget meeting just last week, I presented to the council that with the addition of these 16 new officers, that will allow us to open up the 2 additional pods for holding federal inmates. That would generate an additional $3.5 million in revenue. If we renegotiate that to the actual rate, then that would be an additional $1 million in revenue, which would continue funding for the $3 per hour increase beyond ARPA. We also have revenue from the state of Missouri that is owed to us in the amount of $2.5 million from November of 2021 through April of 2022. And we're estimating an additional $2.5 million from state housing from May 2022 through December of 2022. It takes about 6 months for that process for billing, and then an additional 6 months for payment. But we also estimate about $200,000 a month in state housing to be billed to the state throughout 2023. We're working with county's legal department, courts, and the state to also get reimbursement for parole violators. We estimate about $120,000 in new revenue per year. And Tricia Rogers already has billed the state for probation violators based on recommendations by KPMG, which or what is it, 200,000 per month? An additional 1 million?
I did 2.1 million I've done already.
She's done 2.1 million already, so moving forward, it'll be about an additional $1 million in revenue each year for that.
That's good. It seems incongruous to me for the state to be as flush as it is and still be in arrears to counties in the way that it is, right? I mean, they had so much money, they did this, you know, a tax cut a few months ago, or, you know, during the special session. What do you expect in terms of the billing timeline with the money that we've just billed the state for?
Well, there has been some improvement. They were a year delinquent in the past, so we're continuing to work with them on processes that can streamline that, and hopefully we'll see progress continue.
Okay. Okay, thank you. Aaron?
Yep, back to the dashboard.
Yes. I know, Tim. That's why I'm freaking out. It's ridiculous, isn't it? Sorry.
Okay, so for the supplemental dashboard, I just wanted to mention a couple things. One is that for overtime hours for September was at right about 5,000, but about 5 days ago, we crunched the numbers for October. I don't have the numbers up to today, but we crunched the numbers for October, and we were on pace as of, so through 23 days of October, we had been on pace to be at about, I think it's like 4370 for the end of the month, if I remember right, for October, which if that pace held up would put us around here, which would be the lowest overtime hours since early 2021. So I don't know if I don't have today's data for October, but as of 5 days ago, our overtime data for October was on pace to be the lowest it had been in over a year. So when we have next board meeting, we can check in on that to confirm.
Okay, that would be helpful.
Yeah, just a real quick comment on that.
Sure.
You know, I think Director Anders mentioned earlier we've hired 70 officers. I'm just doing a little bit of math in my head, but I can't do it that quick. But I'm wondering if, you know, from the council's point of view, if you point out to them that, you know, this line has dropped from, say, 6,000-7,000 down to 4,300 or whatever it was you said, how many overtime hours you saved versus the extra cost for overtime, how many of those dollars saved paid for those 70 positions might be a...
Yeah, so with the new rule change, we are on track to save 13,000 hours of overtime per year, which will save almost $1 million in terms of salary and fringe benefits.
Well, there you go. That's the number I was looking for. That pays for a lot of the new officers, I assume.
Yes, definitely.
Thank you.
Yeah, and then I think the only other thing I wanted to mention from the supplemental dashboard is that our, as Scott mentioned, well, at the beginning of the month, we had 42 CO position openings. We're now, as you mentioned, 39. But the good news is that even if that number, I mean, that number has gone down substantially over a past year. But even if that number stays stable, the resident to corrections officer ratio has improved a lot because the numerator has gone down. So we're at 5.1 resident to corrections officer ratio for October, whereas we were at almost 6 in May. So again, like obviously this ratio is a function of 2 parameters, but with this staying stable, the population decreases have allowed this ratio to improve a lot.
Aaron, this might be a really dumb question, but I've never asked you this in 3 years on this board. How long have you been with the system?
With the county?
Yeah.
2.5 years.
Okay. Was there do you know, so did your predecessor produce something like this
I have no predecessor.
You had, okay.
Yeah.
That's what I thought, but I didn't want to be presumptuous.
Yep.
This
I
is,
mean,
this is,
like others like Beth and Trisha and stuff would pitch in on data, but there was no statistician.
okay.
Yeah,
Okay.
Scott, I don't think we ever saw anything like this before Aaron arrived.
Yeah.
We were kind of flying blind, which was one of the board's complaints. So,
Yeah.
you know, I think this is ability to allow us to not fly blind.
Yes, but not flying blind is always preferable.
Yeah.
Any other questions on the supplemental dashboard before I turn it over to Liz?
Take it away, Liz.
Okay.
As I throw
I'll
things.
get you. There you go.
I hope you've had time to review the dashboard. We seem to be pretty status quo as far as providing services, the clinical, medical visits, health disorders. We did have the death in September, which was unfortunate, but otherwise, the care that we're providing is still pretty much the same. The population that we're serving hasn't changed as far as individuals with mental health disorders, substance abuse disorders, people requiring acute medical care. We've had some people that have been out to the hospital within the last, well, that'll be shown more in October's data as far as being some critically ill patients that we have been caring for here in the facility or out in the hospital. Any questions on the data?
Just real quickly, the two, the columnists, the third column over percentage of provider visits, mental health.
Oh, yeah.
And substance abuse. We talked about this earlier. And so my question and then a follow-up would be, I assume these are not, that the bottom one's not a subset of the top one. Is that correct? They're different categories, right?
Yeah, Aaron, you would have to click on that.
Tim, you're talking about this window here.
Yeah, so that if they go in for mental health disorder, that's not substance use
No,
disorder.
those are different.
Yeah,
I assume they can overlap because I talked with Michael, who's one of the the corrections medicine managers, and he said that people can go in with multiple check marks, but they're certainly, these two are not subsets of one another.
Okay, well, there may be a little bit of comorbidities going on there, but
Sure.
one thing I wanted to do, and maybe Alex can shoot it down or somebody can shoot it down, is I wanted to add those bars together to get a sense of the mental health issue we were looking at earlier, talking about. So like, let's ignore the last month, and you might have like 30% or so with 30 to 40% with mental health disorders, and then you have 12 or 15% with substance use disorders. I want to be able to say, correct me if I'm wrong, that almost half the visits are related to mental health or substance use. Is that correct?
I don't understand your question.
So I'm going to add the
are you
bars at the
asking?
top to the bars at the bottom, and if I do that, I'm getting close to 50%.
I think that's roughly correct, Tim. I think I can't speak to how much overlap there is, in the middle of the Venn diagram. So it's possible that overlap is so big that it's actually not that high.
Yeah,
But
it might not be, but we're probably in the 40 to 50.
I see what you're saying. Yeah.
Yeah, I just sort of wanted to point that out, and if I was completely wrong, somebody could tell me right now, but I think it just speaks to how big the mental health issue is. That's what I was pointing out.
I think you're right, Tim. There probably is some double counting there. If you combine both of them, I think there would be some double counting. Hey, what's the difference between, and I'm sorry I didn't recognize this before, but percentage of persons with psych visit and percentage of provider visits for mental health disorders? Sorry if it's obvious.
Well, the percentage of the provider visit is seen by either the psychiatrist or the psychiatric nurse practitioner. Mental health visits is that you're seeing the social worker, because we have to do screening for mental health. So everybody gets the mental health screen, and then not everybody will potentially see the psychiatrist if they're in the need of medications.
Okay.
Sorry, this is a dumb question. Who does this psychiatrist work for?
Our current psychiatrist works for Department of Public Health,
Okay.
but she will be leaving in November, and we're attempting to hire a psychiatrist through an agency.
To be full-time with Justice Services, or how would, or?
They would be us.
Go.
I mean, they would be under my supervision.
Okay.
Same with trying to hire a psychiatric nurse practitioner. We're challenged in the mental health arena in hiring staff.
So this is like kind of urgent.
It's definitely a concern
Yeah.
for all.
I mean, you have an out date. You have the date. What's the exit date? Like mid-November or?
November the 11th.
Okay.
So how does that fit into the proposed behavioral health services for diverting people away from
No,
being
I mean,
incarcerated? So my point being is that you're absolutely right. It's challenging to find to hire professionals in behavioral health. There's just like the nursing, there's huge competition and a shortage of people power. And so I'm just wondering, since there was a discussion about, partnering with behavioral health providers out in the community, whether that would make sense as well for this service, is rather than trying to hire and create that service internally, whether to have that provided from a community source as well.
An interesting question.
that is.
Do we have, what's our pool look like? Like, since we're two weeks away from the person leaving, which would leave us without psychiatric.
Well, it leaves us out with a true name of a psychiatrist, but our providers can still prescribe and treat for the mental health population. Dr. Davis and her team of 24-hour providers can still see, they do continue to see now our population. We will be working hard with the agency to fill the void of the psychiatrist.
And can I ask, do we have like an applicant pool? Are we interviewing? Do we have finalists? Like, just to get an understanding of kind of where things are.
The agencies are having difficulty finding psychiatrists that they all want to work 1 or 2 days a week.
Yeah.
And they would like to just have multiple people coming through, which is not something that we would encourage. So they're having difficulty finding individuals to, one, come into the facility. So we may have a better chance of just doing telehealth like we're currently doing, which is not ideal.
Yeah.
But that's something that we're working hard with the agencies to see if they can find within the St. Louis region a psychiatrist that's willing to come in and see our population.
Yeah, but no, I think, Alex, your implication is spot on, which is like, does this foreshadow real problems, appropriately staffing a mental health diversion center? Okay, thing.
Yeah, I think it's pretty clear that the two areas that we can use the advisory board's help on the most would be mental health resources and recruiting.
Yeah.
Yeah, that's where I was thinking, it might, and I don't know the particulars of what that would entail, but contracting out for that service so that it's not incumbent upon any one person to cover all of the psychiatric needs, but rather a pool of people that could then provide resources, so it doesn't fall on any one individual. I don't claim to know what that would look like or how it would work, but it's just a thought.
Okay.
Okay.
Sorry to interrupt.
Nope, that's fine. If there's no more questions about the dashboards and the health conditions in the facility, I can give you a COVID update. We have 0 COVID positive individuals in the facility at this time. We've given over 23,000 tests, and we've had 565 positives since the beginning of COVID, which is, we continue to work hard. And I can give you an update on the Medicaid applications for our population. 80% of the residents in the facility have either, they actually have Medicaid or they've been enrolled in Medicaid. This morning I've got 2 more volunteers coming in to assist the population in getting additional people enrolled in Medicaid, and so we are working hard to get everybody and then continue that ongoing. We're making plans. The team is trying to figure out how to sustain everybody coming through as to who has Medicaid and who doesn't, or any other form of insurance, and can we get them enrolled in Missouri Medicaid if they need it.
Just a real quick question on that. You said 80, right? 80?
Yes.
And as you shouldn't throw a person in here who thinks about this all day long, but of the remaining 20%, I would assume that most of them are uninsured, but maybe might have something other than Medicaid, or that's pretty rare, I would assume.
No, we've determined that they don't have anything at this particular moment in time, and we've had to schedule with volunteers to come in, and it's based off of their availability to be able to complete the Medicaid application for the remaining percentage that do not have any at this particular time.
That's great. And if I heard you right, you said that Medicaid's going to help you paying for the drugs. Is that right?
Medicaid will assist the residents when they discharge from the facility.
Okay, great, yeah.
They're not paying for in the facility, no.
Okay, all right. Then I was wrong to hear that. And I knew that was mostly going to be wraparound if they have to go to the hospital or something.
Right,
Yeah.
yes.
But it's still a great thing, especially for discharge and all that you're doing this. And we're about ready to go into the open enrollment period, but I don't think that applies to you. You can enroll these people anytime.
Right, correct.
Have we started
Okay.
vaccinating for flu yet?
Yes.
And how is that going?
That's a challenge to get volunteers for any type of vaccination. So we continue to educate and encourage at time of intake even. So you could get a flu vaccine even though you may not stay here. That is something that's offered for you if that's something you would desire.
Mm-hmm. So it sounds like the uptake has been pretty low.
I don't have exact numbers, so I don't necessarily want to truly go on record to say exactly how many.
Yeah, I understand.
Just historically, it's been a challenge.
Well, kudos again to you on your COVID numbers. They're obviously 0 is a good number. And if I computed the percentage right, it's about 2.4%, which is, Alex can tell me if I did that wrong, but that's pretty good. That's a good positivity number.
Well, Justice Services and the medical team work hard to keep everybody healthy, so.
Yep.
All right. Thank you, Liz, for taking us through the dashboard. I'd be remiss if I didn't acknowledge that we did have a key staff departure at DPH since the last meeting. Valerie Nelson resigned from, from her position with the county, which I want to thank her publicly for her service and her really amazing work over the last few years in helping facilitate, I think, much stronger coordination between the security side and the medical side here at the facility. So I want to just formally recognize her contributions, her passion and dedication and work ethic here. Dr. Hinrichs, do you want to, I think this is your first board meeting. Do you want to introduce yourself and talk a little bit more about the current structure and your interface with the jail?
Yes, I'd be happy to. Thank you, Jeff. I'm Dr. Jim Hinrichs. I'm an infectious disease specialist. I've been with DPH since about May of 2020, and at that time joined primarily to help with COVID issues as well as communicable disease response. Sam Page asked me to become acting director, co-director of the department in September. So I've been in this position since that time. Before that time, I worked with Valerie in terms of some of the clinical decisions, et cetera. And I do want to echo your praise of her ability in this realm. I can't totally speak to why she resigned. I think part of it is because of our ongoing disparities in salary structures in order to recruit some of the same things that you were talking about earlier as far as nursing staff, LPNs. This is a countywide problem that has frustrated all of us, but we are going to continue to pursue some equity in that so that we can hire more registered nurses as well as LPNs in both corrections and the clinical side, just so that we don't have such a reliance on contract staff, which clearly expands our expenses. So we want that ratio to come down. So I've been working very closely with Liz in terms of trying to come up with additional solutions on staffing. I'm going to be working further today with some of the headhunters to see what we can find in terms of the psychiatry need that obviously we're going to be in the midst of very shortly. So I will certainly love to work with this group in the time that I'm with DPH and with Liz specifically. So any questions that you have that come my way, please feel free to interact with that. But I'm going to be much more hands-on until we can either post a replacement for Valerie's job or see which direction the DPH leadership really wants to take. So I appreciate the invitation, and I'm looking forward to staying on this board in whatever capacity I can.
Thank you, Dr. Hinrichs, and apologies for mispronouncing your name the first time.
Not a problem. Half my family does too.
Not a problem that I have to deal with. All right. Nice to meet you. And anything else on corrections medicine or anything else? Dr. Garza, Dr. McBride? Okay. All right, is there any public, Tricia, is there any public comment? Okay. The next two board meetings are the third Fridays of the month to make sure that we don't conflict with Thanksgiving and Christmas. So the next board meeting will be November 18th. Before then, though, we will all be touching base through our subcommittees with the leadership here. So that will be the next time that we are in touch. And if there's no further business before the board, then I would move to adjourn. All those in favor, say yes.
Yes.
Aye.
Yes. All those opposed, say nay. All right. The meeting is adjourned. Thank you.
Hey,